Doctor, my periods last 10 to 15 days every month. I have to take around 5 to 6 painkillers during my menses. Every month I have to take leave from work. I have been admitted to the hospital because of heavy bleeding and low hemoglobin. For 2 to 3 days every month I have been confined to the bed. My family thinks I'm overreacting, but they don't know how much pain I'm suffering from. If any of these sound familiar, this video could change the way you understand your problem. The ultrasound report says no fibroids. The hidden reason could be adenomyosis, a condition that many women have never heard of, and this can be causing or affecting their quality of life significantly. And many women suffer silently for years before getting the correct diagnosis. The good news, not every woman requires hysterectomy. Today I'll be explaining what is adenomyosis, why is it often missed, how is it diagnosed, what are its common symptoms, and how is it treated. Your ultrasound report says no fibroids, but every month there is heavy bleeding, there is significant pain during menses, and you feel bloated. What is adenomyosis? Normally, the uterus has inner lining called endometrium and the muscle layer called myometrium. During menses, the endometrium sheds away. In adenomyosis, the inner lining endometrium grows into the muscle layer of the uterus, that is in the myometrium, and gets trapped. Every month, whenever menstrual cycle happens, even this trapped tissue also bleeds. Because this is trapped inside the muscle layer, this causes inflammation, uterine swelling, pain, and very heavy bleeding. What are the symptoms of adenomyosis? Heavy menstrual bleeding, severe pelvic pain, premenstrual bloating, constant pelvic heaviness, passing large clots because of excess bleeding, iron deficiency anemia symptoms like fatigue, tiredness. Why is it often missed? This is the biggest problem. Many women don't even know that this disease exists. Even ultrasound may miss it or mistake it for fibroids. The correct modality used to diagnose adenomyosis is MRI. This can confirm adenomyosis even if the fibroids are coexisting with it. Many women spend years taking painkillers without knowing the real reason behind it. So what are the treatment options? Painkillers, this will only reduce the pain but do not treat the disease itself. Hormonal medicines can reduce the bleeding episodes, but it will reoccur when the tablets are stopped. And then we have Mirena, that is intrauterine device. It works well for many women, but not for everyone. The overall satisfaction rate varies between 50 to 60%. But some women experience irregular spotting, acne, bloating, mood changes, headache, and sometimes it might get expelled. But if Mirena is working for you, that's excellent. But if it is not, then you still have another treatment option. Adenomyosis can be treated by uterine artery embolization. The procedure is performed through a small access in the leg region without any surgical cut. Here, instead of removing the uterus, we block the blood supply feeding the diseased muscle. Over time, the uterus becomes less inflamed, pain reduces, bleeding improves, and uterus shrinks. And the best part is around 8 out of every 10 women experience significant symptomatic benefit that allows them to avoid hysterectomy. The last treatment option suggested is hysterectomy, but it is very important to know the reason to avoid hysterectomy in young women suffering from adenomyosis is many studies have attributed that young women, those who have undergone hysterectomy, even though if it is ovarian sparing, still continue to have metabolic syndrome or metabolic effects such as increased risk of heart failure, stroke, high blood pressure, diabetes, and dyslipidemia. So if you have been told that there are no fibroids, but still your bleeding is heavy and significant pain is there, then do ask your doctor that could it be adenomyosis. And before deciding on to hysterectomy, do ask that whether you're eligible for uterine artery embolization, because many women do not know that this treatment option also exists. If this video has helped you, share, because someone you know may be silently suffering from heavy, painful periods without even knowing the real cause behind it.